By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. Let's go back to our scene with Gene and Anthony. We'll pick up just before the AED arrives.
28, 29, 30.
I got the AED, but I don't know how to use it.
I got it.
I don't know if I can answer all of your questions, so I'm going to put you on speaker mode and put the phone next to the man who's helping him. This is the dispatcher.
Can you hear me? We have an AED. I'm attaching pads now.
Yes, I can hear you.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Everybody stay clear. Don't touch him.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. When sudden cardiac arrest develops, the heart quivers and stops pumping blood. A shock from an AED stuns the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you will hear prompts telling you everything you need to do. AEDs may have adult and child pads. Make sure you use the adult pads on anyone 8 years of age or older. Peel away the backing from the pads, following the pictures found on the pads. Attach the adhesive pads to the person's bare chest. If the AED recommends a shock, it will tell you to stay clear of the person. If the AED tells you to clear the person, then loudly state, "Clear." Look to be sure no one is touching the person just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. Following this demonstration, you will have a chance to practice using an AED trainer, just so you can see what it's like. You'll start with your hands in place to give compressions, and the AED will arrive immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay, everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay, everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
You'll need to consider a few special situations when using an AED. First, if the victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has two sets of adult pads, you can apply one set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. Water on a victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, do not place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that AED. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. AEDs can be used for children and for infants too. Many AEDs have pads for adults and a child pad cable system or a key. But if there are no child pads, or if there isn't a child key or switch, use the adult pads. Also, if the child is 8 years of age or older, use adult pads. We have more information on providing CPR and use of an AED for children in separate menu options on this video. The DVD will now pause for you to practice with an AED trainer. And don't worry, it can't really give a shock. Now we're going to demonstrate how to put it all together, from scene safety and assessment, to providing compressions and giving breaths, to using an AED. Afterwards, you'll get a chance to practice. First, check to make sure the scene is safe, and make sure the person is lying on his back on a firm, flat surface. Tap and shout to see if the person is responsive. If the person is unresponsive, shout for help. Sir, are you okay? Are you okay? Help, help, I need help. And ask someone to phone 911 and get an AED. You, phone 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. Now, tilt the head back and lift the chin to open the airway and give 2 breaths with the mask. Remember, do not interrupt compressions for more than 10 seconds. Repeat. Now, tilt the head back and lift the chin and give 2 breaths with the mask. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay, everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay, everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
Since you've now had a chance to practice compressions, you can see that providing CPR requires intense effort. It can be tiring to keep up the pace. Therefore, if someone else knows CPR, take turns providing CPR by switching at least every 2 minutes, even if you're not tired. Let's watch our opening scene and pick up the action where Gene is providing compressions and Barry, the airport security guard, offers to help.
Yeah, take over CPR.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26,
Paramedics are here. Thank you.
29, 30.
I can take over.
As you help each other and take turns providing CPR, it's important to give each other feedback. While you are resting, remind the other rescuer to push down at least 2 inches at a rate of 100 to 120 compressions per minute, and to let the chest come back up to its normal position after each compression. This concludes the adult CPR AED section of the video. Let's take a look at what you've learned. To provide high-quality CPR for an adult, first assess the need for CPR by making sure the scene is safe. Then assess if the person is responsive. Tap and shout and ask if he's okay. If the person is unresponsive, shout for help. If someone comes, have that person phone 911 and get an AED. Then scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. If no one comes to help you and you have a cell phone, phone 911 and put it on speaker mode so that you can hear the dispatcher's instructions. You will also need to get an AED. You've learned that high-quality CPR is made up of 2 skills, providing compressions and giving breaths. To provide effective compressions, push down at least 2 inches at a rate of 100 to 120 compressions per minute and let the chest come back up to its normal position after each compression. You've also learned how to give breaths with and without a mask, quickly and effectively without interrupting compressions for more than 10 seconds. The first compressions are the most effective overall, and they become less effective as you get tired. So remember, if another trained person is present, take turns at least every 2 minutes, even if you're not tired. And you've learned how to use an AED to give a person in cardiac arrest an even better chance of survival. Use the AED as soon as it arrives. Congratulations, you've just learned CPR and AED use for adults. The video will now pause for your instructor to test you on these adult CPR AED skills. This section of the HeartSaver CPR AED course covers the special situation of known or suspected opioid overdose and the availability of naloxone. You are likely to encounter the person with the overdose in a home or isolated location where other equipment such as an AED is unlikely to be present. It's important that you know how to respond. Across the United States, far too many people are dying from drug overdoses. These deaths are largely due to opioids. Common opioids are morphine, fentanyl, heroin, oxycodone, and hydrocodone. Opioid overdose can lead to sudden cardiac arrest. That's why it's important for you to know how to respond to this life-threatening emergency. There's a safe and effective way to help someone with an opioid overdose. Naloxone is a medication used to reverse the effects of an opioid and help the person to survive. If you know of someone who has been prescribed naloxone, and you are familiar with or have been trained in the use of naloxone, you may use it to save a life. Common signs of opioid overdose include unresponsiveness with shallow or slow breathing, or even no breathing or only gasping. You may suspect opioid overdose if you see signs of the drug nearby, or there is other evidence of drug use. If you suspect someone has overdosed on an opioid and the person is unresponsive but still breathing, yell for help. Phone 911 and stay with the person until someone with more advanced training arrives. If the person is unresponsive, meaning he or she can't cough, speak, or breathe, then start CPR. After 5 cycles of CPR, phone 911, get the naloxone and AED. Give naloxone right away, and then assess the person's responsiveness. If the person is unresponsive, use the AED and continue providing CPR. You've just learned an incredibly important life-saving technique, how to help with an opioid-associated life-threatening emergency in an adult. For more information, refer to your student workbook. The video will now pause for you to review naloxone.
I brought over the proposal, and I need for you to tell me what you think.
All right, let's take a look. You look at page 2, there's a high-level view of the company.
Actually, you know what? I think I have my own copy. Right here.
Are you choking?
Can I help you?
A business lunch with an associate can turn into something entirely different when he starts choking. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding his throat. If this happens, you need to act right away to try to clear the airway. When a person's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might be choking and it's severe, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that he or she is choking and cannot talk, you need to act. You'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around his or her waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she becomes unresponsive. An adult who has been given thrust should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the choking is severe and the person is pregnant or very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. Watch and see how this might happen and what you should do.
Sir, can you help me lower him to the ground? Phone 911 and get an AED.
When a choking adult becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. But do not perform a blind finger sweep, because the object may become lodged further back in the airway. Each time you open the airway to give breaths, look for the object in the back of the throat. After checking the mouth, give 2 breaths and then repeat 30 compressions. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.